Hi, we are Tima in CSC 542 in University at Buffalo under Dr. Michael Buckley. Our system is a smart asthma monitor which helps the communication between a teen suffering from asthma and their parent and the parent better. The biggest problem for a teen suffering from asthma would be the parent is nagging about their dosage patterns, the medication intakes, and monitoring them. And our system, what it does, it bridges this gap. It helps record all the timestamps of the dosages taken, the medication patterns. It records them and allows the parents and the healthcare provider to view these records and do whatever necessary. So what it does is this eliminates the necessity for the parent to go ask or nag the teen about their dosage intakes, about the medication patterns, and also what it does is help communicate between the patient and the healthcare provider as well. The healthcare provider will also be able to view these data will be able to view this dosage intakes and incorporate the necessary action plans into the system and monitor the patient without having to actually consulting the patients. So let us start with the demo now. This is the home screen, and there are two levels of access here. The one is the parent or the patient level, and the other is the doctor's level. The doctor's level, what it does is it allows the doctor to view the log, as I said. It allows the doctor to record the dosage patterns and view them and make a decision on the progress of the patient. It also allows the doctor to edit the action plans or make a new action plan and those kind of privileges, and it will also help allow the doctor to give feedback to the patients. Whereas the parent's login or the patient's login will only allow them to view the action plan, unlike the doctor where they can edit it. So let's start with the demo. Let's first go into the doctor's login. This is the login screen where the doctor could log in here. We have a login for Doctor 1. So this is the home screen for the doctor. Among the different things what the doctor can do here is select the patient for which the doctor want to, for whom the doctor want to do the actions. He has a couple of options here. He can either select by name or he could select by the patient ID. This is the sample data set that we populated here, so he can choose one of these, not necessarily both, just one of these, and continue with it. So first option would be to view the log of this user. Here he can set a time range or the time period between which he wants to view the data. And there are two options for him to view the data in. One is a table and the other is the graphical format. The tabular format will give the doctor a tabular view of the data collected from the time period he selected. This is a sample data set that we populated, and this is a table. And for the same period, he could choose the same way time period, and he can view the same data in a tabular format or a graphical way, which will allow the doctor to interpret the results better, since it's presented in a more pictorial way. So this is the pictorial representation of the data. The same thing we saw earlier in a tabular format is here presented in a graphical format. Here we've used color codes where green represents the dosages taken in the evening, the red represents the dosages taken in the afternoon, and blue represents the dosages taken in the morning. The same way, different things can be incorporated here, and different data could be represented in any other graphical format, not necessarily a bar chart. And so that was the view log capability, and then next is the edit action plan. Here the doctor will be able to edit the patient's action plan. Here we have three zones here. The zones are the degrees of or the levels of attack the patient is in. The green zone is a pretty safe zone where the patient just got to follow the normal dosage patterns, Yellow is a very cautious zone where the patient has to be more cautious about his dosage intake without shouldn't skip dosage patterns and that kind of zone, a cautious zone. Whereas a red zone is a danger zone where the patient has to be really very careful about his medical and dosage intakes. So the doctor could select one of those zones and define the or given the medication for that particular zone. It could be green, could be yellow. He could select whatever zone he wants to, and give the medication and the dosages as well. Say 1 puff or 2 puffs or anything of that sort, or even define times, the time zone between time period between which the patient should be taking the dosages and submit it. This will be incorporated into the users or the patient's action plan, which we'll be looking at a little later. So that was the edit action plan. Next is the treatment summary. Once the doctor is done with the treatment or the dosages or having a look at the log, the doctor can give feedbacks to the user or the patient through this form. Here he could submit any feedbacks he wants to, or any comments he wants to wants the patients to know. So, and he can type anything here, just anything, and hit submit. And again, this will be posted on the patient's login when they log into their accounts. This is the patient feedback. The other feature what we have here is the patient, when they log into the account, they could view, as I said, they could view logs. All that will be looking a little later. They can view logs, the action plan. Also, they could give feedback to the doctor. The patient or the parent could give their comments to the doctor. What it does, it eliminates the necessity for the patients to unnecessarily visit doctors, consult doctors, go in person. Rather, they could use them a mail-like feature where they can simply put in their feedback, and the doctor will be able to view it here. And again, having read that feedback, the doctor can go again back to his login and give a reply through his summary. So that's the doctor's capabilities. Let's log out and log into the parents or the patient's login. We have a patient login here. So go ahead. Yeah, this is the home screen of the patient. Again, here similarly, the patient will be able to view the log. Select the time period, just like this is very similar to the doctor's login. Select the time period between any time period he wants to view in, and again the patient will have two options: one to view in tabular form, and the other is to view in a chart form. This is the tabular format, very similar to the doctor's login. And again, very similar to the doctor's login, and this is the chart format. The uniformity is again maintained here. It's green for dosages taken in the evening, red for the dosages taken in the afternoon, and blue for the dosages taken in the morning. Again, any graphical format can be incorporated into here. It doesn't have to be a bar graph. The next is the action plan. How is it different from the the doctor's login? Is that the doctor there will be able to actually edit the action plan, could actually give in the action plan, define the various dosages and the medication that the patient has to be taking. Whereas here, the patient will only be able to view the action plan. As the medications defined by the doctor there in the different zones. The same again is used here: green zone, yellow zone, and the red zone. The green zone is a safe zone, yellow is for cautious medications, and the red is for emergency or rather danger zones. When the doctor selects a particular user and defines their action plan, that will be incorporated here, and this is what is also incorporated into the into the system, the puff or the inhalers, by which the different alerts will be generated. So this is the action plan where the user can view it and know what he should be doing on different zones. And the doctor summary here, the doctor summary will allow the user to view the doctor's comments on the patient's progress, on their progress and their medication patterns, what should be done and what shouldn't be done, what should be followed, and all that. Those comments can be viewed here. The doctor will submit their comments in their doctor's login. And this is patient's feedback, a similar feature to the doctor's summary, where the patient can actually give it just any feedback, anything, any discomfort they are feeling, or anything of that sort. And this will be submitted to the doctor's login, and they can view it there. So this is the SAM asthma monitor system, and there's a lot of scope for it to being extended in the future. You could use GPS, real-time tracking, and all that. So this is smart asthma monitor, and thank you from Team R.